is the Essential Medical Checkups every healthy woman should have. The tests you need depend on your age, your health, your family history, and other risk factors. Screenings can help find problems early when they may be easier to treat. Our Dr. Narula is here with a medical checklist for women of all ages. Good morning.
Good morning.
I'm nervous about how many of these I've checked or not. So
let's find out.
So for women who are in their 20s and 30s, overall good health, what are some of the things they should be looking at?
So this is a time when a lot of women are not thinking about going to the doctor, but it's really the time to set the foundation for two things: prevention, which is what we're talking about today, and prioritization of their health. So while it's controversial whether people need an annual physical exam, it's good in your 20s to 30s to get a baseline evaluation so that you can establish a relationship with your doctor of trust and communication. You can have your risk factors evaluated. You can talk about your family history. Important things in 20s and 30s: blood pressure and cholesterol. You need to start checking those at age 20. In addition, you may want to consider being screened for STDs. Some of them may be silent and they can lead to infertility.
And what about in terms of cancer at an early age?
Right. So cancer, again, not something 20 and 30-year-olds are thinking about, but cervical cancer, second leading cause of cancer death in the age range of 20 to 39. Two things that are effective in helping fight cervical cancer: the HPV vaccine, which you can start getting at age 11 to 12, but up to 26, and the Pap smear, very important in picking up those early atypical cells. That should start at age 21. You should get the Pap every 3 years, and then at age 30, every 5 years, along with the HPV test.
I was surprised you didn't mention skin cancer.
Yes, skin cancer, another one that we don't often think about. Melanoma, incidence rising over the last 30 years in women. Women more likely than men to get it when they're under 40. Not something that's routinely talked about in terms of getting screened for, but important for people to start just paying attention. Take a look at their body in a mirror every month. Look at areas you might not think about: the palms of your hands, your nails, your ears. And if you see something that looks like it's changing, enlarging, talk to your doctor about that.
The interesting thing here for me is that there's some tests that people need to ask their doctors about they don't know about.
Yes, well, I mean,
and the doctors don't normally do.
Well, as we get older, certainly things like colon cancer screening for women in their 40s to 50s.
Which is considered middle age these days.
Which is considered,
although
yes.
I think
I am middle age then.
60s, 70s middle age, I think. But go ahead.
So usually,
and you're right on that.
Yes, I think so too. Go ahead.
Colon cancer screening starting in your 50s unless you have risk factors like a family history, inflammatory bowel disease. In addition, mammograms starting at age 45 every year. And blood sugar tests, not something, again, that we may think about, but in your 40s, if you're overweight, have high blood pressure, high cholesterol, gestational diabetes history, you need to get your blood sugar checked.
Quickly, please hit 60.
60, vision. So lots of the vision disorders may be silent until you lose your vision. So you need to start getting screened for that. In addition, bone density at age 65 for women. And one more thing I want to mention: mental and emotional well-being. Not something we focus on. One of the Surgeon General's priorities. Extremely important for people to talk to their doctor about that and for doctors to screen for that.
That's a good one.
Very good note. Thank
Yeah.
you, Dr. Tara. Always good to see you.
You too.